To fear or not to fear, that is the question. We all know being afraid could accompany cold feet, cold sweats, panic, phobias, and even pure terror. Too many women avoid going to the gynecologist because they're afraid. But early detection is the key to treating many cancers and STDs, which can be deadly if you don't catch them early. So giddy up, put your feet in the stirrups and ride away to better health.
That's great, and we have Dina here with us, and you're a little bit afraid of something, right?
Just a little bit.
Okay, and that would be someone like me, an OBGYN, right?
Yes.
Okay, and we're gonna get that fear away from you. We want actually your OBGYN to be your girlfriend, okay? And I know everybody's going like, oh my God, my OBGYN, like my best friend. And so what I'm gonna do today is I'm gonna give you my girlfriend gyno guide, okay, to your gynecologic exam by telling you exactly what's gonna happen. So you ready for my girlfriend's guide?
Yes, tell me.
All right, so when you go in, and you can also go in with a friend, whatever makes you feel comfortable, we will, take a history from you, kind of find out exactly what's specific to you. Then what we want to do is get you in the stirrups or in these things where you can just put your legs in and make sure the room's really comfortable for you. And we start very simply by first, with our gloved hands, letting you know where we are, okay? So we're gonna put our hand on your thigh, and then we're gonna look. We're gonna look at the outside of the vulva, of the vagina. We're gonna look for any lesions, any bumps, any ulcerations. We look very methodically. Now, this is also better if you're groomed down there, because then we can find a lot of things, okay? So you might think about trimming a little bit. Then what we do is we also want to make sure that everything looks good inside. So that's when we use the speculum, but this helps us look inside of the vagina. Now this comes in lots of different shapes and sizes, so make sure that if it's uncomfortable, you tell, because we can give you a smaller one. And we warm them up, okay, so that it's nice and warm, it doesn't cause a problem. Now I'm going to show you exactly what we start to see vaginally, okay? We look inside the vagina to actually look for any discharges, any masses that may be on the vaginal wall. We can also, at this time, just use a Q-tip. It's a simple Q-tip to take cultures, and that's for any infections. And if you told us to check for any STDs because of partners, then we'll do that as well. So we do this with the speculum. We can also see your cervix and see if that has any ulcerations, lesions on that. So this is all the things that we're looking for. So we're really looking for a lot of things. We look at the shape, we look at the size, we look if it's red or inflamed, all these different things. Then we take the speculum out, and that's when everybody usually wants to hop up off the table. And we tell you, no, stay there. And that's because that's when we do the pelvic exam, all right? And that's when we use our 2 fingers, just these 2 fingers, and I'm going to tell a whole world of things that are going on inside you with just my 2 fingers. Okay. First, though, we're gonna feel on your stomach to see if anything is in there so large that we can feel it from your abdomen, or if you're tender there. Then again, vaginally, we're gonna put those 2 fingers in, and we're gonna put them inside, and what we do is it's all about feel, and we've been trained for this in residency. And basically, we put our fingers in, we feel that tip of that cervix that we showed you, and that actually feels like, go ahead and feel your tip of your nose. That actually feels like the tip of your nose. And we feel that, and we see if you're tender with that when we move it. We see if it has, again, if it has anything on it that we could feel but we couldn't see, and then we move it around and see how mobile it is and what the position is. And then we go ahead and we sweep our fingers, again, underneath here, and we're gonna go, and I'm actually gonna take this out, because this is like really cool. We feel your ovaries, and the normal ovary should feel like an almond, the size of an almond. So we sweep our fingers around, and we feel that almond just between our fingers like that. One is on top, and the other one's inside, and we squish it in between to see if it's tender, if it has mass like a cyst on it. Then we sweep closer over to see if there's a mass on the tubes, and then we go underneath the uterus and over the uterus to kind of see, again, where there are any masses like fibroids or things like that, and then we do the other thing for the other side. Okay. Now, if you're over 40, which you're not, we warn you about, and they should warn you about this part of the exam, which is a rectal exam. Basically, we'll put 1 finger in the vagina and 1 finger in the rectum to see if there's any masses in the rectum, and to see if there's any masses on the ovary that have fallen behind your uterus that we couldn't feel on the pelvic exam. So very important after 40.
Okay, and how often should you go?
For a young, healthy woman like yourself, about every year. Sometimes if you have abnormal pap smears, you may have to go more frequently than that. If there's anything else in your history, if you need more breast exams or things like that, then you discuss those specific things with your doctor. But usually a healthy, sexually active woman, about every year. Again, we want you to come have a good experience and want to come back.
Yeah.
Yeah?